Good morning, everyone. We're going to get started in just a few minutes. So we'll give a few more folks. We had 49 RSVPs today. We hope to see all 49 of these folks, but we're going to give them just a few more minutes to join us. And I'll be admitting folks as we go along here over the next couple of minutes. And then we will get started. It's good to see everybody. We have had, I'll go over some ground rules for you guys with these wonderful Zoom meetings, which I'm sure you all just absolutely love in this time of COVID-19. But it's good to see some faces. But just know, and I'll say this again later, that we will be turning your cameras or your video off for you once we turn it over to our presenter today. And I'll go over that in more detail because it lessens distraction. Sarah, like that. And the noise and mute. So we'll make sure everybody is muted and video off once we get going. But we'll give a few more minutes for folks to come in.
There's a face I recognize.
Good morning. If you're just coming in, we'll be with you in just a couple minutes, letting some few late arrivals come in. I recognize that spelling of Marilyn. Hey, Marilyn. And another old friend of mine, Louise Leckleitner. Good morning, Louise. You don't have to unmute yourself. I see you there. It's been a while.
Can you hear me?
Who is that? Can you state your name?
Hard to know who that is.
Oh.
Are you talking to me?
Was that who said, can you hear me? I can't hear you.
That's Imelda.
Hi, Imelda. We can hear you.
Yeah, it says, I'm getting a prompt and it says you cannot start your video because the host stopped it.
Yeah, we're going to keep the video off because it's less distraction for the meeting and have you on mute as well. So we would appreciate that. But I'll start the meeting here in a minute and I'll go over some ground rules.
Okay, so I'll mute myself.
Thank you very much. See if there's any more folks in the waiting room. I will let folks in along the way too as well. And Andrew, if you could, as my co-pilot here, if I'm speaking and you see folks come in, if you want to let them in, can you do that with the co-host authority?
Yes.
Awesome, thank you. All right, 10:05 is going to be the start. Okay, welcome everybody. My name is Mark Nanzer. I'm the Executive Director for the Retired Employees of San Diego County. I want to welcome everybody to our next in the line of virtual RESDC presentations. It's great to see everybody today. Thank you all for attending. Before I introduce today's presenter, who is Matthew Parcasio from the County of San Diego Aging and Independent Services, I wanted to go over a few Zoom meeting logistics with everybody. So during my introduction and as folks come in, as I mentioned to some of you earlier, my colleague and fellow RESDC staff, Andrew Steele, and I will be muting and stopping everyone's video. So you may have noticed your video was stopped when you came in, and there's a purpose for that. It basically limits the background noise and distractions while the presentation is going on. We found that that is much more helpful in the times we've done these presentations. So we'd appreciate your assistance in staying muted and stopping your video during the presentation. Now, as for questions you may have for Matthew, we found the best way is to not have questions during his presentation, but to actually use the Zoom chat function. And I'm going to show you kind of what that is if you're not familiar with that. I'm going to share my screen with everyone. So this is an example of a Zoom screen. It may have different spots for the things that you see at the bottom, that bar, but there's the mute and start, mute and unmute, and start and stop video. And then you'll see this one that says chat. If a question comes up that you'd like to ask, what we're requesting is that you click on that chat and a screen like this should show up, or similar to this, where it says chat, and then you have the option to send it to someone. It's a drop down, it says everyone right now. That may be where it prompts when you click on that, but when you open it up and drop it down, you'll see RESDC, who is me. So my name is RESDC for the purposes of Q&A. And you can send me an actual question. What I will do is gather those questions, put them on a Word document, and when Matthew is done with his presentation, I will go through a Q&A with him and ensure that I get to everybody who may have had questions. And I'll do my best maybe to combine questions if there are similar questions as well. So we'd appreciate it if you would use that, that function of the chat to ask questions. So thank you again for that in advance. And let me see here. Wanted to let you know that we are recording this meeting. We try and record all of our RESDC virtual meetings, so with that we can post them on our awesome RESDC YouTube channel, which can be found at our website, which is very simple. It's just www.resdc.net. We encourage you to if you have the time, to go in and check out some of the past presentations we have there, and some great presentations we did in 2020. This is our first one in 2021, and then we also will have some other ones I'll be telling you about in a second. So before I turn it over to Matthew and do a brief intro of him, I'd like to ask our president, Stan Coombs, who's in the room, if he'd like to provide, the RESDC president that is, would like to provide a brief greeting to our attendees. And Stan, if you're there and you are not muted, and there's your picture. Take it away.
Well, thank you. Good morning, all. I'll be very brief. Welcome to Virtual RESDC and Aging and Independent Services Programs and Resources. I hope you'll all enjoy yourselves this morning. It's a happy sunny day. Have fun. You're up again, Mark.
Wow, that was very brief. That's the brief if I seen you, Stan. You need to replicate that during board meetings. Just kidding. Okay. Thank you very much, Stan.
I tested my audio. It's doing good, but it's not.
Oh, see, there's an example.
Yes,
we're going to mute anybody that I hear someone speaking, but we're trying to mute folks so we can hear everybody. I hear somebody there, but I can't make it out. But I think you were successful in muting yourself. Okay. So I'm very excited to announce that today's presentation is the first in a series of virtual presentations by our partners at Health and Human Services Agency, Aging and Independent Services through the County of San Diego, and that we're going to be hosting over the coming months. Really pay attention and stay tuned to upcoming network newsletters and email blasts promoting these great events and great presentations over the course of the next few months. The next one up will be in April. It'll be on April 4th at 10 a.m., but I'm not going to go into too much detail. I'm just going to tease it and say it's going to be another great presentation. And I really want to thank Aging and Independent Services staff for this great partnership and the opportunity to spread the word about the excellent programs and services they offer. We're pleased to be hosting this presentation today, which, as Stan briefly mentioned, is an overview of Aging and Independent Services Community Programs and Resources, Project CARE. Project CARE stands for Community Action Reaching the Elderly, which Matthew will go into a little bit more detail. And Matthew Parcasio, who is our presenter today, works as an outreach and education staff for AIS and presents on a variety of programs and services offered by them and their partner organizations. Matthew, I really want to thank you once again for the planning that we've done leading up to this and for your presentation today. And I'm going to turn it over to you and mute myself and get out of Dodge, at least for my picture, that is. Thank you.
Mark, thank you so much for the introduction. Hello, everyone. Welcome, and thank you to all of you as the members of RESDC. Thank you to Mark and Andrew and Mr. Stan Coombs for the invite. and the opportunity to present to all of you this morning. I am so appreciative of the time, and thank you so much for spending your time with us today to hear all the great things that I hope to share with you this morning within the next hour. Again, from the County of San Diego, Health and Human Services Agency, Aging and Independence Services, Health and Community Engagement Team, Outreach and Education. So perhaps like a lot of you who may have been previous county employees, I've had a long title similar to mine, but as Mark mentioned, I'm with the Outreach and Education Team at Aging and Independence Services. So prior to March of 2020, my role in the county at Aging and Independence Services was to do presentations in person, to share not only the information that you're going to hear today, but a couple other topics of interest related to older adults and adults with disabilities. I was kind of a road warrior, so to speak, where I would drive from different locations in the region to provide in-person presentations to older adults, adults with disabilities, health professionals, you name it, anyone interested in learning about what we do. But since the pandemic, my role has now shifted to providing virtual format presentations like this. And although I do miss the in-person presentations to be able to share information and resource, what a great way to connect still with our community and folks like yourself that are interested in learning more about what we do and what might be beneficial not only to you, maybe someone that you know, you may be caring for an older adult or an adult with disability, or you may be interested in learning about what services and resources are available to you in the near future. So that's my hope today, is to just give you a snapshot of what we do. It's going to be a lot of information. So I'm going to go ahead and get things going. So I'm going to go ahead and start to share my screen. Okay, so Aging and Independence Services, as it was mentioned, is part of the Health and Human Services Agency. Some of you probably may have been employed with the Health and Human Services Agency. Within the Health and Human Services Agency, as you may or may not know, has multiple departments. In the Health and Human Services, or HHSA, there are a lot of acronyms, as you all know and are probably familiar with acronyms in your respective departments being in the county. I'm going to try to stay away from all the acronyms, but in the Health and Human Services, you have child welfare that obviously serves children. Then you have us at Aging and Independence Services. And I also was discussing with Stan a little earlier that if you were, or maybe currently living outside of the County of San Diego, or you may have lived in another county in the state of California, our services in that respective county is called the Area Agency on Aging, or AAA. We were the Area Agency on Aging, but then had since changed our name to Aging and Independence Services, because we also not only serve older adults, that's anyone 65 years of age and older, but anyone 18 to 64 years of age with a physical or mental disability. So we want to make sure that our adults with disabilities have that connection, have that resource to go to where there's no wrong door, that they're going to be able to get resources through us as well. Then we also have our behavioral health services. Behavioral health services has been a great kind of partner with us at Aging and Independence Services to be able to make awareness of the different mental health programs and substance abuse disorder services that are available to our community members here in the County of San Diego. You may be familiar with a program called the Up to Us. The Up to Us campaign provides a 24-hour access and crisis line that anyone can call 24 hours, 7 days a week to talk to a health professional if they may be dealing with a mental health disorder, anxiety, depression, bipolar disorder, even quite possibly if someone is feeling thoughts of hopelessness or even suicide, that they can be able to reach out to a health professional if they're not comfortable talking to a loved one, a family member, a friend, that they can talk to a professional for free. Then we also have the self-sufficiency programs, or otherwise known as our family resource centers. if you or someone that you know may need to or interested in applying for Medi-Cal, they could call our Access Center and talk to a Family Resource Center representative to get the process going to apply for Medi-Cal. Or if you had someone that you know or you think you may qualify for CalFresh, which used to be known as food stamps, is now coined as CalFresh, that all you need to do is also call our Access Center and talk to a Family Resource Center representative to get set up for CalFresh and quite possibly be approved for benefits. The other option, and I'm sure some of you may be familiar with this great organization, which has been, again, another ally to us at Aging Independent Services and the Health and Human Services Agency right now, that you've been hearing quite a bit of, is 211. So yes, you may be hearing 211, and a lot of their efforts are, like us, in regards to COVID response and supporting our community members with setting up a vaccine appointment, but they also do a number of other things and provide another wealth of resource to older adults, veterans, family members. Persons can also apply for Medi-Cal or CalFresh by calling 211 as well too. Then we also have the housing and community development. Housing and community development was just recently added in 2016 that we recognized in the Health and Human Services Agency. Our agency director, Nick Mascione, and our leadership identify that yes, health and home and health, those two things go together. So we are so excited to know that this has been recently added, because then we are able to really have our colleagues in the county to support and try to provide more homeless outreach, offer rental assistance, especially to our older adult and adult with disability population that are maybe at the brink of homelessness or worried about trying to find affordable housing in our community. So we're so glad for those reasons that our housing community development certainly, although fairly new and certainly has a long way to go to help address the challenges of housing in our county. We know that the San Diego is probably one of the most beautiful places to live. I myself came from the county of Monterey, from a small town in Salinas, but I also understand that the county is also very expensive to live and that we also have a homelessness issue to deal with. So now that's why I'm, again, excited that the Housing Community Development Department was recently added. And last of the Health and Human Services Agency departments that you've been hearing probably more of than ever before since March of 2020 is our Public Health Department. That includes our Public Health Officer, Dr. Wilma Wooten, other of our medical professionals, our dedicated nursing staff, and other public health staff that are doing their best right now in the hopes to decrease the spread of COVID-19. And now with the vaccinations and the appointments and the different efforts that we are doing to make sure that the persons who are eligible for the vaccination are able to get it at this time, certainly is what we all are working towards. All of us in the Health and Human Services Agency are doing our part to support our community to make sure that we decrease the spread and still encourage folks to continue to follow the public health orders of wearing a mask or face covering when you're out and about. Continue to wash your hands and at least do their best if they are out to practice physical distancing. We hope one day that we are able to shake hands again and have public gatherings and be able to do presentations in person. We still have a little ways to go, but I'm very hopeful that things will turn around soon, especially that we are seeing a decrease in the number of cases as a result of the number of vaccinations that we've been giving thus far. So that, in a nutshell, is the Health and Human Services Agency. Now I'm going to share all the 30 programs that you may have never heard of before. Maybe you've heard about some of them. Some of you may be well up to speed about what we do, and I'm going to give you that information today. All of those departments that I just mentioned earlier, including Aging Independent Services, follow the Livewell San Diego vision. The Livewell San Diego vision is a vision of our region in the county that is building better health, living safely, and thriving. And those are the three components of the Livewell San Diego vision. And at Aging and Independent Services, as well as the other departments in Health and Human Services Agency, have programs that fall under these three components, So you're going to see as I talk about all the programs that we have programs that build better health, our safety programs like our Adult Protective Services program, and then our Thriving, which include volunteer opportunities and ways to engage. If you are so inclined, you're welcome to visit our site if you haven't done so already, is to go to www.livewellsd.org. So a great website to view, and you can also see all the other Livewell San Diego partners, the 500 plus partners in the county from different respective regions and sectors, including for-profit, community-based organizations, schools, all these organizations in our county that are doing great work, that have also said, yes, we want to be on board with the Livewell San Diego vision with the county and have who we serve build better health, live safe, and thrive. Now, back in 2010, our public health department identified that there were roughly about 687,000 San Diegans 55 and over. By the year 2030, which is so hard to believe that that is in about 9 years, that the number of 55 and up adults in our county is going to be about 1.2 million. Yes, that is a large population. And a lot of folks would assume that the fastest growing age population would be those 65 and up. Yes, our baby boomers are a large population in the nation. But the fastest age growing population in the nation right now is those who are 85 plus, our 90-year-olds, our centenarians. Every time I meet and have a chance and opportunity to meet a 90-year-old or 90 plus, I always try to ask them the question, what's the secret? Is it a piece of dark chocolate every day? Is it a glass of wine at night? Who knows? No one will ever tell me the secret. But we hope that with our programs and support services and information that we are be able to offer in our county, that we're helping these San Diegans live health, safety, and thriving lives and live in the comforts of their own home for as long as possible. And how we do that is a term that some of you may be familiar with or may be hearing for the first time, called person-centered care. Really meeting people where they are, where there's no wrong door that they could reach out to us and connect for services that they may need to know about. Yes, we have 30 programs, but Aging and Independent Services doesn't have all the programs or all the answers in our county. So if needed, if we need to meet persons where they are, whether it be doing a in-person presentation or providing a nurse and a social worker, doing a case management assessment in someone's home safely, really meeting people in their homes and being able to provide them those connections. If they don't have transportation, for example, we don't have a transportation program. However, we may refer to a great organization called FACT. Facilitated Access to Coordinated Transportation is a great organization that is actually supporting older adults during the pandemic to get them to vaccination appointments if needed. Or if they are requiring durable medical equipment, we may be able to connect them with some organizations to get physician-ordered durable medical equipment if needed. So if people need to connect to us, we really want to be able to be that first connection if needed, and to say, wow, I didn't know that you did that, nor did I know that you were able to connect me to resources outside of what you all do at the county. And how to best do that, if there's any piece of information that you take with you this morning, is to remember our phone number, the 1-800-339-4661. That phone number is our contact for our information and referral phone number from 8 a.m. to 5 p.m. Monday through Friday. After 5 o'clock or on the weekends, we are available solely to take calls of elder and dependent adult abuse, which I'm going to get into very, very shortly. But otherwise, to inquire about our other programs or to get connected with other resources is to reach out and call the phone number. And Lynn, pictured there, is an aging program specialist like myself who will take calls for free to support older adults, caregivers who may be calling, anyone living out of state that has a loved one that lives here locally in the county of San Diego, to provide support, information, and referral for free. Now, if someone were calling out of state and had an area code outside of 760, 619, or 858 area code, then they will get us if they were to call out old phone number. So some of you may be familiar with the 1-800-510-2020. Now, if you called us and had a 760 or 858 or 619 area code, yes, you would in fact get us. But otherwise, the main number 1-800-339-4661 will get us directly. Now, our programs range in everything from programs for persons who are very independent, so wanting to learn about ways to manage a chronic condition, volunteer opportunities, to persons who probably are at a good level of independence, but may need a little bit of help and support along the way. That may, for example, some of those programs that may benefit would be case management or home delivered meals, or one of our more well-known programs called IHSS, or in-home supportive services. Then we have programs for persons who are more vulnerable, those who are most at risk, those who may be living in rural parts of our regions that don't have connections to those who live in more densely populated areas, or where they're able to access resources and are more readily available to them, as opposed to those who don't have as much connections. We want to be able to serve all of our older adults in the county and adults with disabilities as best we can. Now, to help those who are most vulnerable, those who are at risk of abuse, we have a program called Adult Protective Services. And Adult Protective Services has a lot of misconception and a lot of fear from many who hear the name or hear APS, or Adult Protective Services. A lot of people assume that Adult Protective Services has this authority to remove older adults or adults with disabilities outside of their, from preventing them from leaving their home. And so that's not what we do. Adult Protective Services does not have the authority to remove people out of their home. What Adult Protective Services does everything possible to protect older adults from physical abuse, financial abuse, abandonment, abduction, neglect, self-neglect, mental suffering, and isolation. And those are the different types of abuse that if we were to receive a call on our call center that I just shared with you earlier, our call center representatives like Lynn take, and also Adult Protective Services kind of first line of calling, is that if they were to take a report, we would then refer the information to our Adult Protective Services team, who would then determine if a in-person visit or further investigation is required if in fact abuse is actually happening. Now, a lot of times, unfortunately, we do have to work in partnership with law enforcement. Unfortunately, if there is what is considered a perpetrator involved, who may be taking advantage of a older or dependent adult, or there may be suspected abuse involved as a result of a perpetrator. So whether it be law enforcement, or we've worked in partnership with our district attorney's office if needed. Certainly those are the instances where we hope that don't happen, of course, but a lot of the times what we find is we have calls come into us. A prime example is a neighbor may be calling and saying, I'm not going to tell you who I am. I'm not going to tell you how I'm involved, but I know someone I am a bit concerned about. I've noticed that, and I've observed they're very frail. They live in their home alone. I can tell they may not be having an adequate nutrition. Their weeds are piling up in the front of their house. Their car is rusting. It's not moving. Their dogs aren't well taken care of. I'm very concerned for this person's health and well-being. Well, again, we don't have that authority to remove that person if we think that they're in a bad situation. We may then do a visit. We may suggest, Adult Protective Services may suggest to that person a number of resources that might be available to them. And if that person does in fact agree to, let's say, home delivered meals or in-home supportive services to maintain or increase their level of independence, then that's a positive outcome for us. And that's what we always hope that Adult Protective Services helps to determine if in fact resources and support can be provided to folks, and ultimately protect persons from abuse is what Adult Protective Services' main goal for older adults and adults with disabilities in our county. Now, to make sure that persons make informed choices and also stay safe, is to help persons make a very difficult decision. Some of you may have come across this decision to have to place a loved one, whether it be an aging parent, a spouse, a sibling, whoever it is, into a next level of care. You may have been caring for them at home and had to find placement for the first time. What a difficult decision that is to have to make, and to have to place the care in the hands, your loved one's care in the hands of someone else. What we've done to help start that and make that a smooth start is to create this website called Choosewell San Diego, which provides a listing or a rating system of a number of different assisted living facilities in our county. It doesn't have all the assisted living facilities in our county, a good majority of them. You would wonder why some of them would not want to be on this list, but it allows someone finding placement to say, okay, there are these locations here in the county of San Diego that I want to choose from. I want my loved one to stay here in San Diego. I can see that this place costs this much. I can see what their staffing ratio is. I can see if they have specific requirements for my loved one's care. I can even quite possibly see if this place has any violations. So that way people can make that right decision, hence the name, to choose well to find placement for their loved ones. Now, in order to protect persons or residents living in an assisted living or getting rehab in a skilled nursing facility or participating in an adult day healthcare or adult daycare program, our long-term care ombudsman, some of you may be familiar with the term, it may have actually volunteered with our ombudsman staff, but our long-term care ombudsmen protect older adults and adults with disabilities that are quite possibly in those settings. So our dedicated staff of ombudsman team will make sure that all those types of abuse that I just mentioned a moment ago are not happening. And our ombudsmen also advocate for patients living in assisted livings or in a skilled nursing facility. So if someone that you knew, or maybe even you, were in a rehabilitation skilled nursing facility and needed completion of an advanced healthcare directive, the document which states what happens to you in the event of an emergency or what your medical decisions are, the ombudsman could be present at the skilled nursing facility with you to witness your completion of the advanced healthcare directive. So just other ways that our ombudsmen advocate for residents and persons in a skilled setting or assisted living. Now, the Choosewell San Diego website helps persons to find placement, whereas our case management programs help persons to stay in their home. So if someone says, you know, I want to stay in my home for as long as possible, I don't have a lot of support, I do have some medical issues that I'm managing and dealing with, I want to stay home, quite possibly they might be interested in case management and qualify for case management programs, where we have our dedicated nurse and social work team will go and do an initial assessment and meet with the potential case management recipient and assess their needs, medical needs, social needs, and then come up with a plan of care and set some goals to say, okay, this is what we're going to do to help you stay at home if that's what you want to do. And then ultimately follow up and check to see how things are going and to make sure that they have what they need, that additional resources might be referred if needed. And so there we have different types of case management programs that persons might qualify for based on their criteria here. For example, that we have case management programs for veterans, for example. So all someone would need to do is, if you or someone that you know might benefit from case management, would be to call us at the 1-800-339-4661 to determine and find out if a case management program would be fit for you or someone that you know. Now, probably our most well-known program is called In-Home Supportive Services, or IHSS. In-Home Supportive Services is serving nearly over 29,000 recipients at this time with care in their private residence and in their own home. Now, in-home supportive services, if you may be familiar with home care, or it's also called non-medical home care or private duty, just the different names that it's termed as, there are hundreds of home care agencies in our county that charge everything from $20 to $30 an hour. So if you add that up on a monthly basis, that's quite costly. But if someone were to qualify for in-home supportive services, they would not have to pay for any of the hours of care that they receive at home. However, in-home supportive services is the only program that someone would have to pay a small fee for the care. If our in-home supportive services eligibility department did the assessment and determined qualifications for someone, found that they met the criteria, but actually had assets, they may have to pay a small share of cost. But definitely the share of cost would be a lot less as opposed to paying for privately a home care agency that would be obviously charging per hour. So the primary qualifications for in-home supportive services, as you can see on the slide there, is that someone must be on Medi-Cal or be Medi-Cal eligible. That is the primary qualification for in-home supportive services. In addition to being a Medi-Cal recipient or Medi-Cal eligible, someone must be 65 years of age and over. They may be legally blind, or they may not be able to physically care for themselves at home. So if they meet those criteria, our in-home supportive services will then determine the amount of hours that someone is approved for. So if someone is approved for in-home supportive services hours, let's say they get approved for 80 hours a month, and that's how the hours are approved, is on a month-to-month basis. Now, if someone is approved for a certain amount of hours, they can then choose who they want their caregiver to be. So they can say, I want my daughter, who actually lives with me, to be my primary caregiver. Or I want my grandson, who visits me 3 times a week. He's been providing care to me and care and assistance already, so I want him to be my caregiver. Or I have a trusted church member that's a caregiver, and he or she's been caring for me during the week. In-home supportive services allows someone to choose who they want, so as long as we determine that that person is capable of providing the in-home care to that recipient. The recipient cannot choose a home care agency to provide the in-home supportive care services. It must be a trusted person capable of providing the care. Now, once someone has been approved for hours, someone has chosen their respective caregiver, the caregiver will then be compensated for the hours that is provided to that recipient. So that person, the caregiver, can provide activities of daily living care, or ADL care, which is the acronym. So that includes bathing, dressing, grooming assistance, meal preparation, light house cleaning, medication reminders. It doesn't approve transportation, unfortunately, under those hours, because technically it's not in the home. But all the things that will allow someone to remain independent in their home is what the in-home supportive services will be able to authorize and allow the caregiver to provide to that recipient. Now, hours of care may quite possibly increase as a result in a recipient's decline and increased needs and care. So a in-home supportive services social worker will then oversee and manage the care, work in partnership with the recipient and the caregiver, just to follow up and check to see that things are going well with the in-home supportive services, and quite possibly to determine and assess if in-home supportive services hours need to be increased. So that's in-home supportive services. We also recognize that not only are we concerned for older adults and adults with disabilities in our county and to help our population live well, but we are also concerned for our caregivers, those caregivers who are supporting those older adults and adults with disabilities in our county. So you yourself may currently be a caregiver. You may have one point been a caregiver. I myself have been at one point a caregiver, caring for my grandmother with advanced Alzheimer's disease. And caregivers all too often understand that, you know, they a lot of times don't want to take a break, or don't want to burden others with the care needs of the person that they're caring for. Sometimes don't know where to turn, where to go for resources, and how to learn the skills, to hone their skills of becoming a better caregiver. A lot of times caregivers don't become a caregiver overnight, or I'm the opposite. Sometimes caregivers have to be a caregiver and become a caregiver overnight for whatever reason, due to the decline of their loved one or a sudden hospitalization as a result of their loved one, and then when they come home have to care for that person's needs. So we work in partnership with some great organizations in our county, including Southern Caregiver Resource Center. You may have been familiar with Southern Caregiver Resource Center. If you are a caregiver and you are providing care to someone that you know, they will provide care support services, including opportunities for support groups, educational classes. They will provide even opportunities for caregivers to get a break. And so Southern Caregiver Resource Center, again, will be able to provide those free programs and support and connections to those caregivers in need of support and care for the persons that they're caring for. The best quote that I ever heard in my career thus far regarding caregivers, and some of you as caregivers may know this, that the best, basically, you are only as good a caregiver as you are a good caregiver to yourself. Excuse me just for a brief moment. Sorry about that. We also understand that there are many grandparents or what we consider older adults raising young ones, grandparents raising grandchildren for whatever reason. We have older adults who are maybe put in the position of having to raise infants, toddlers, teens, college-age students. So we want to make sure that those caregivers are also supported just as much as any other caregiver would in our county. So what we have done is we've created our intergenerational programming and some great partners in the county put together what we call a Grandparents Raising Grandchildren Handbook. It's a free handbook available in English and Spanish, and persons can just call us at the 1-800-339-4661, and we'd be happy to mail someone a copy of that Grandparent Raising Grandchildren Handbook for free. Now, prior to the pandemic, we hosted a number of different nutritional programs, or otherwise known as congregate meal sites, where we were able to allow older adults and adults with disabilities, their caregivers, to congregate in locations where they could get a nutritious meal at a very low cost, or quite possibly a donation if they didn't have the money to pay for that nutritional meal that day. So a lot of our senior centers, even some of the Salvation Armies, hosted nutrition programs or congregate meal sites. Since we aren't able to host gatherings as a result of the pandemic, a lot of the programs more readily available now are home delivered meals. So a lot of great organizations, including Jewish Family Service, are providing home delivered meals to our county. So allowing the opportunity for folks to get them basically delivered to their door safely and be able to offer additional meals so that folks can get those nutritional meals that they need. Another great program that you may be familiar with or may have heard of more recently that was created is called Great Plates. The Great Plates program was a federally funded program that started back in May, and the County of San Diego and Health and Human Services Agency procured a number of restaurants and catering companies that work in partnership with this program. So these restaurants and catering companies in the different regions help to prepare these meals for older adults who qualify. So if someone were 65 years of age and over, if they met the income requirement, because the Great Plates program was actually designed during the pandemic to meet the nutritional needs and food needs of those who don't qualify for low income meal programs. So those who are of middle income, who are 65 and over, who are in fact having difficulties accessing and preparing food, could quite possibly qualify for the Great Plates program. Otherwise, if persons don't qualify for the Great Plates, they can call us at 1-800-339-4661 to explore the different home delivered meal options, or again, call 211, as I mentioned at the very beginning, to not only find out about vaccine appointments, but also find out about the various home delivered meal options available to them in the community. Now, programs for client safety. One of our programs that, as a matter of fact, I also, as part of my role at Outreach Education to help to oversee, is called Project Care. Project Care was created about 25 years or so ago It started in very grassroots. We had local organizations and senior centers basically calling older adults and doing what we call the check-in calls, or "Are you okay?" phone calls. Now, to some, that might think, oh, I don't want another phone call. I don't want I have too many scam calls calling me already. In fact, we do have quite a few older adults that are currently utilizing Project Care and saying, I live alone. I don't have a lot of support. I do have some medical issues, and I want someone to check on me to make sure I'm doing okay, even if it just were on the phone. So that's what Project Care does. As one of the components of Project Care is that if someone were to call in and say, I'm interested in Project Care and I want these regular check-in calls, we will do an initial assessment, find out what their care needs are, see if there's make sure that they're living at home safely, and set them up with these regular calls during the week. And they will in turn say, okay, I want to be called 3 times a week at this time of the day. Perfect. Someone will be called on, let's say, Monday, Wednesday, Friday. They call on Monday. This is your regular check-in Project Care call, just checking to see that you are okay. They answer the phone. They say, yay, doing great. They're either live or an automated system. The automated system or a live person will then call on the Wednesday, check in. The recipient answers the phone. Perfect. On Friday, let's say, the system or a live person may call the person. They don't answer. It just keeps ringing. Our partners working in partnership with Project Care, which is 211 here in San Diego, and in North County, Interfaith Community Services, if they notice that someone is not answering the phone, and by the 3rd or 4th call they're still not answering, they will start to call and reach out to emergency contacts. And if the emergency contact is not available, you can see on the image there, we have some retired senior volunteers, or our YANA, which stands for You Are Not Alone, which are retired senior volunteers, are dedicated volunteers that work in partnership with the local sheriff's department or police department that drive around in unmarked vehicles and drive in pairs and see them in uniform, that they too can also be reached and knock on someone's door if there's a concern at someone's home. Now, we've had many instances where some older adults have told us, oh, I left for the grocery. I forgot that I was going to get my call today. Sorry about that. But in other instances, we've called the emergency contact and they've gone to the home and they've actually had to call 911 for first responder and emergency assistance. Now, one of the primary things that Project Care provides, and we will mail this to community members if they are interested, is that we provide what's called the Vial of Life, as you can see that there. This is a sleeve. It has a magnet in the back that can be magnetized onto a refrigerator. At the very front, it says the Vial of Life. In the event of an emergency, dial 911 and give this information. And it has our phone number at Aging and Independent Services. In this sleeve, it has a 2-sided sheet where you would complete, or if you're completing this on someone's behalf, you would fill out list of medications, health history, emergency contacts, what someone is allergic to, maybe someone's hospital preference, who someone's advanced healthcare directive decision makers are, where the dog may need to go to in the event of an emergency. So we would suggest to have this completed, all the pertinent information that a first responder would need to know. Let's say if you or someone that you knew was unresponsive on the ground and a first responder were to come in their home and needed information about someone. We would hope that they would find this on the refrigerator or somewhere accessible, because in addition, there's also a sticker that someone can put on their door, on the side of the ledge of their door if they want, just to identify that there in fact is a Vial of Life in that home. Now, if there are multiple persons living in the home, yes, we encourage folks to make sure they complete one for each person in the residence. We've even suggested that folks put a small picture so that they know whose list of medications is going to the emergency room. The last thing you would want if there's multiple persons in a home is to have the wrong list of medications being sent along with you during the ride to the emergency room. So our paramedics, I myself have presented to AMR I have myself, along with my colleagues Annabelle and Hazel, have presented to our local fire departments, sheriff, police, and they are well aware of the Vial of Life and really encourage those to have this available on their refrigerator. So that's the Vial of Life and Project Care. If you are interested in a Vial of Life, all you have to do is call us and we're happy to mail you one. Again, that number is 1-800-339-4661. Cool zones during the hot summer months. You know, again, it feels like summer right now, only in San Diego, where around, you know, beginning of March, and you know, it starts to become very beautiful and can't beat the weather. But during the hot summertime, we have set up what's called cool zones, or locations basically where older adults or adults with disabilities can go to keep cool. Now, this past summer, we were fortunate to at least open a few locations safely. Following the public health orders, we had a few locations where they were able to host a small group of persons, physically distant, wearing face coverings, washing their hands throughout the day, and being safe. We certainly hope this summer, if we are able to, and again, we cross our fingers that we will be in a less restrictive tier, especially with the decrease in cases and the increased volume of vaccines that are distributed and given to folks, that we might be able to open more cool zones in the future during the summertime. Cool Zones during the summer also offers a free fan in partnership with SDG&E. A lot of people don't know this, but if you called 1-800-339-4661 and it was very, very hot and you didn't have a small plug-in electric fan, we would actually be able to supply someone a free fan if they needed through the Cool Zone program. Again, it's just a 3-level fan, and it's, you know, kind of the, you know, just a plug-in, but we have a stock of them at Aging Independent Services during the Cool Zone summertime to be able to distribute if people need it. Again, all by calling 1-800-339-4661 for a fan. Now, we also have healthy and fitness classes, which include our Feeling Fit, Tai Chi, and Healthier Living with Chronic Condition class. Our Healthier Living with Chronic Condition class was a 6-week course that we adopted from Stanford University and wanted to bring it here to the County of San Diego to help those who are managing a chronic condition. So whether it be arthritis, heart conditions, whatever it is, that after this 6-week course, persons can feel, okay, you know, maybe managing this chronic condition isn't so as bad as I thought, that I can still live at a good level of independence and feel empowered after taking this course. This course is transitioned towards from being in person to now being online, just like a Zoom format. So to learn more about maybe participating in the online Healthier Living with Chronic Condition class, you can go to the healthierlivingsd.org website and quite possibly inquire to participate in that class. Now, at the top there, that's a picture of our chronic condition class there up top. Below is a picture of one of the many Feeling Fit classes that we used to hold prior to the pandemic in person. We had numerous locations hosting on average 60 to 70 older adults in person, whereas now we have transitioned and are also in the process of making the Feeling Fit exercise class online. And the healthierlivingsd.org is where you can find more information if you are interested in participating in the online Feeling Fit Club. Now, Tai Chi isn't unfortunately online just yet. We are working towards it becoming that. It's become more and more popular over the years, and I'm sure we had quite a few requests for it to become virtual, but that is still in the works. But our Feeling Fit and Healthier Living class are transitioning. Now, the last of the kind of health, safe, and thriving or Livewell vision is the thriving, and that would include our intergenerational programs and volunteer opportunities. I have a colleague, her name is Pam Plimpton, and she has the neatest job ever of pairing youth and older adults together for intergenerational programming. Now, the image there that you can see is a picture of an event that we used to hold in person called the Intergenerational Games, where we paired 3rd graders and older adults together for just a day of fun, of non-strenuous activities. We used to hold it at the Chula Vista Elite Training Center. And it was just a fun day of seeing how the generations come together for a day of fun. And being so skittish at the first time of meeting each other. And by the end of the day, we had third graders that would tell us, this was the best day of my life, and I met a new friend. So just hearing those stories and hearing the connection from the older adults that participated, what an amazing day, and what the power of intergenerational programming does. Now, Pam Plimpton, a lot of since the pandemic we haven't been able to host a lot of in-person programming recently, but we've been able to, or Pam has been able to connect older adults and youth online and has done a lot of virtual connections. As you all know, we are now in this kind of tech and online format. So what she's done is she's created some programming via online, and has, as a matter of fact, been able to connect some youth that are outside of our country to some local San Diegan older adults here through some virtual programming. So very exciting the ways that she's still being able to continue the program that we do. We are also providing at least some ways that older adults still can engage. And we have our what we call our Ways to Engage flyer. And I'm going to make sure I share it with you at the very end, because towards the end of this presentation, or at the end, I want to share some website resources to keep handy with you, because our retired senior volunteers and other partners also created a Ways to Engage. Although there aren't many ways to volunteer in person at this time, there are still many opportunities that folks can still get engaged during the pandemic. Now, you are hearing the overview of programs and resources. In the image there, you can see that's me and a Spanish-speaking interpreter. I was at that presentation was presenting to 50 Spanish-speaking caregivers who are caring for adults with Alzheimer's disease or other related dementias. So this is my primary presentation. I also do that presentation on the signs and symptoms of Alzheimer's disease and where to get support. I also do a presentation on the Advanced Healthcare Directive. So I certainly hope all of you on this call today have completed one. Or if you've completed one a while ago, it's always recommended to take it out and review it again, make sure that it's up to date. And what I'm referring to again is the 12-page document that basically states, in the event of an emergency, if something were to happen to me, or if I were to require medical care or medical attention, this is the type of care that I want, and this is the type of care that I don't want. This is the person that's going to speak for me in the event that I can't speak for myself. I've chosen this person and the second person as an alternate to basically convey my healthcare decisions and what I want and don't want, whether I'm hospitalized, or if in fact, let's say I stop breathing, this is the decisions that I want. These are decisions that I don't want. This is also what I want if in fact I expire. These are my burial arrangements. These are what plans I want. These are all the things that I want to in having this discussion about the Advanced Healthcare Directive. Having to complete the Advanced Health Directive document is the easy part, but having the discussion with a loved one or a person that you're wanting to make decisions for you is the tough part. So we strongly encourage persons to understand the importance of completing an Advanced Healthcare Directive sooner than later. Annabelle Kirkendall, my colleague, which you'll probably be hearing from very, very soon, as Mark alluded to at the very beginning, you're going to be hearing from our team at Aging Independent Services and our topics of specialty. She covers and does a presentation called Don't Get Hooked, where she goes over the different scam and fraud that's going on in our county. Some of you may be, and not only in our county, but anywhere, where scammers or perpetrators are calling persons and doing the IRS scam. Some of you probably heard about the IRS scam, or you may have heard of the grandma-grandpa scam, including a number of COVID-specific scams. So Annabelle is going to really dive into a lot of those scams and how you and others don't get hooked. She also does a presentation going in a little more depth on the types of abuse that go on. We do a number of elder abuse training in our county to social workers, case managers, medical professionals that actually require the Adult Protective Service training on a yearly basis. And we also offer it to community members that really want to know how to protect and how to identify if abuse, if in fact is actually happening. Hazel, my colleague, Hazel Quinones, is our specialist on mental health. So she talks about two presentations called Good Mental Health is Ageless and another presentation on the prevention of substance abuse. And all three of us actually do all of these presentations, but we actually have our specific topics of specialty. And all three of us more recently have done a presentation on the coronavirus. We've done a coronavirus 19 overview snapshot and bringing awareness of the importance of following the public health orders and where to get support and making sure, again, having folks wear their face coverings when they're out in the community, encourage the importance of physical distancing and washing your hands, wash your hands, wash your hands. So that is the outreach education list of presentations that we offer in our community for free. Now, just to let you know, we are working towards helping San Diego become an age and dementia-friendly community. So I hope that in the years to come, I hope that as I could hope to stay in the county, is that the County of San Diego becomes age and dementia-friendly when I'm at that point. And what we've done is that we have heard from community members. We've worked with partner organizations and other stakeholders to say, okay, what are the biggest challenges? What are the things that we need to address to make sure that our county can be age and dementia friendly? So obviously the areas of housing, transportation, medical and social services, emergency response, ways to engage social participation, caregiver support are all the things that we can help move the needle forward to become age and dementia friendly. Prime example, we hope one day that bus drivers will be trained on Alzheimer's disease and the awareness of signs and symptoms. So if a patron gets on the bus and they identify that that person has some memory impairments or is confused about where they need to go or how to pay for the bus toll, that they will be more sensitive to the needs of someone that has memory impairments to be able to allow that person to stay in the community as long as they can. So just some things that, really, the goals that we're wanting to set that we really envision to become age and dementia friendly in our county of San Diego. So if you're interested in learning about participating in those efforts, again, you're welcome to call us at 1-800-339-4661, or you can even reach out to me if needed. We also have a number of collaborative groups in our county that are coming together to advocate for their respective regions in the county of San Diego. So we have our what we call community action networks. We have a East County Action Network, a South County, and a North County and Central, where we have senior service providers that come together and say, okay, how can we better advocate for our older adults and adults with disabilities in our community? Can we put on an event or educational resources that we can offer to them so that our community is supported? So all of us at the county, at Aging Independent Services, and our other organizations are really coming together to really meet those needs. There's also a fall prevention task force. There's a health promotion committee, including an advisory council that is made up solely of older adults that help kind of drive our programs and help to move them forward. So if you're interested in learning about more of those, you're welcome to give us a call on our phone number. We also have a Aging Independent Services newsletter, which is headed always by a great article by Kim Gallo, our Aging and Independent Services Director, on the very front. It also has a number of other great articles and highlights of volunteers, older adult volunteers in our county, great events. There may be some online events that you might be interested in hearing of. So if you want to get this either via email or actually mailed to you, a hard copy, you can call us at 1-800-339-4661. So again, you've heard the number probably multiple times here in this presentation today. If any piece of information that you didn't get a chance to catch because it was a lot of information, that when in doubt, to keep our phone number handy and to be able to reach out to us if needed, if you're ever interested in information referral. And what I'd like to do before I conclude my presentation this morning is to show you and where to reference our online resources. And a lot of people are interested, how do I go online to view all the programs that Aging Independent Services offers? Well, here it is. It's aging.sandiegocounty.gov. And that's, again, aging.sandiegocounty.gov. And you will land on this page where it lists all the programs that I just shared with you in this past hour, just a moment ago. So you can highlight on any particular ones. So if you said, well, I forgot about what Matthew mentioned about in-home supportive services. You can click on in-home support and can get the full rundown of the qualifications and the process and steps to apply. Now, if you or someone you may know is interested in getting updated information on the coronavirus, which some of you probably have already viewed our website, probably on a daily basis, trying to get an appointment scheduled, for example, the website is coronavirus-sd.com. And when you land on coronavirus-sd.com, obviously those are most interested in learning about the coronavirus vaccinations and how to get appointments set up, and when is it my turn to get the vaccine. You can click on right here, and you'll land on this vaccine page. And to see county vaccination sites and make an appointment, it'll be this first tab here. Obviously, if you're interested in finding out if it's your turn to get a vaccine, if you are in the tier or in the phase that's able to get vaccinated, you can click here, of course. And if and when you are able to, you will end up on this page, which again, probably some of you have viewed quite a bit. And to find the nearest location, either to you by site or schedule, can click on both of these tabs to inquire. And this is the best recommendation that we encourage folks to make an appointment either this way online if they are wanting to get a vaccination at one of our county-run sites. For example, a lot of our locations are county-run. We also work in partnership with UCSD Health. As you may be aware, the San Diego Superstation, which is at the Padres Stadium there, that is the UCSD Health. Rady's Children is also hosting a vaccination site. Sharp Grossmont is another location where folks can get it. So when in doubt, we encourage folks, one, primarily to go and ask their doctor if they are able to get the vaccination through their primary doctor. If they're not, then maybe quite possibly inquiring through their pharmacy. I've had talked to a number of seniors because one of my role right now is to call our most vulnerable and homebound seniors to find out how can we best support them to get a vaccine. Some of them actually told me and said, Matthew, I couldn't wait. I actually was able to get an appointment at my local pharmacy. I was there at the right time. They had an appointment available that someone canceled an appointment, and I just happened to get there to get my prescriptions, and sure enough, I was able to get vaccinated. So if a physician, a pharmacy, or a county-led site are all ways that people can get their appointments. We are working towards supporting our older adults, especially who are living in senior apartment buildings, where we have worked in partnership with what's called Operation Collaboration, where the local fire department and Health and Human Services Agency are actually going into senior apartments and setting up what we call pods, points of dispensation. So we've been setting up those sites, and we are also working on creating a mobile vaccination service for those who literally can't get out of their homes. So that's in development and currently in process. So yes, I know always the biggest challenge is the availability of appointments. It also has to do with supply. I myself don't know what the supply is incoming to our county, but we know that supplies are coming, sporadically throughout throughout the day and weeks. So we encourage people to, if they're going on this website, to constantly check it every day and to open their options of getting a vaccine, because we know how challenging it has been, especially for some. So coronavirus-sd.com is our website. Again, for the further information on the websites, this is also resources to manage mental health during COVID-19. So this is the behavioral health resources. And at the very beginning, I alluded to the access and crisis line. It's 1-888-724-7240 to talk to a mental health professional 24 hours, 7 days a week. This is our self-sufficiency programs. If someone is needing to apply for Medi-Cal or CalFresh, can also get more information here. Our housing and community development information to get COVID-19 emergency rental assistance information, can access that info here. And the last thing that I want to do before I conclude is just to let you know where to access more COVID-specific resources for older adults. If persons need that, if someone you know is 65 and over, having a tough time accessing an appointment, all the options that I just talked about earlier, those persons can call 211 to see if they can get support accessing an appointment through any one of the county locations. They can't guarantee that they'll get an appointment for that day, but they will help to support someone 65 and over if they need help getting a vaccination appointment if needed. If folks need a little more information about 211 and their assistance with the vaccine, we have provided flyers in English and Spanish. Caregivers, both formal and informal, are able to get vaccinations, so as long as they provide proof that from the primary doctor of the person that they're caring for that says, yes, this caregiver is caring for my patient. They in turn can get a vaccine when it's available. And folks can inquire about a ride for a vaccination, all by accessing this flyer, which is available for download in PDF version. Now, for more home delivered meal options, persons can click on here for the different meal delivered services, more transportation options, other mental health resources for older adults, other things that we've identified to support those that need the most help, especially our older adults and adults with disabilities. The ways to engage that I referred to earlier, can print a copy of Getting Connected during this time, during the pandemic. We created this handbook during this time to really help support our community to stay connected, whether it be virtual like this or other ways that they can, even via phone, and even staying connected. And certainly that's my hope today, is to be able to keep you all connected with our resources and support that we offer in our county. I hope that you've learned something today, and I hope you got all of that. I know it's a lot, but I can't thank, again, Mark, Andrew, and Stan for the opportunity to present to you all today. I hope I didn't go over time, but I guess we'll now open it up for some questions.
You did not go over time, and you did an outstanding job, Matthew. We really appreciate it. There's so much great information. And before we get to the questions, I just wanted to follow up on just a couple points. First of all, you would reference the intergenerational games. I did it one year. It was one of the most outstanding experiences I've ever had.
So fun.
And I recommend it highly if you have not tried it. I know it's different now. Pam Plimpton does a great job with, I'm sure, transitioning into the era of COVID and providing that great program. But it was just, like you said, a fun day, a bonding day for myself and the young man that I was paired with. And I still got the picture in my office of the
That's
two of
awesome.
us, and it was a great experience. Secondly, I referenced earlier the next presentation in the series that of this partnership with Aging and Independent Services, and Matthew did as well, but I got the date wrong. So it's Tuesday, April 6th, and more information will be posted. We're going to send an email out to folks. We're going to be putting it on our April Network newsletter with all the details, and that one will be Annabelle Kuykendall, who Matthew referenced as well, Tuesday, April 6th, and that presentation is titled Living Well and Ways to Engage. And more information will be coming on some of the other topics that Matthew mentioned as well. I actually wanted to share something as well, share my screen with everyone real quick. So Matthew, I don't know if you knew this, but we do have this is the RESDC website. Just real simple, once again, www.resdec.net. We do have a link to the county COVID webpage right on our front page. It's very important for us in terms of trying to make sure people have access to the most up-to-date information about how the county public health department and the county overall and your division are working to get this information out so that people are informed, so that it is there as well. And you can access that. And then the other thing I wanted to mention is, going back to the RESDC webpage, is there was just a ton of information that you put out, and I really appreciate you repeating phone numbers for those taking copious notes themselves. But I wanted to show everyone our RESDC YouTube channel. Let me go back and just a little slower. So on the homepage of RESDC, www.resdec.net, News and Events is a drop-down. You can go click on that, and you'll see a variety of different pages, but the RESDC YouTube page, click on that, and it'll bring you right to that page. So it's easy to find. Hey, there's Stan, hosting last year's Virtual Holiday Fest, and just the variety of other meetings we've had. So I highly encourage you, if there's something you didn't catch, go back and give us a couple days. We will be posting this presentation. Go back and check the RESDC YouTube channel out, and you can go through and maybe get to certain sections of Matthew's presentation and be able to get other information out. But once again, Matthew, outstanding presentation. And now I'm going to stop share and I'm going to ask you, we had 2 questions.
Okay.
The first question is there any program to help low-income elderly with finding affordable assisted care facilities? And I know you touched on it, but I wanted to at least ask the question to see if you had anything further.
Yes, what I usually distribute in our county is the housing directory for folks interested in affordable housing, anyone as young as 55 and over that may need to look at the different options. Although Aging Independent Services doesn't help define placement, we can certainly provide that entire listing of the affordable housing openings that are available in our county. And if you don't mind, I can just actually go ahead and share again and reference it on the website. So if you go to the Housing and Community Development website, or link here, you can click on the Housing Resource Directory. And that literally gets to the 55 and over affordable housing list. And you can actually print it if you want, if you're interested in just actually going through it physically if you need to, or you just want to view it on PDF version that way.
Great, thank you. Before I get to the next question, I just want to remind folks before we wrap up for today, if you do have a question that you didn't get to ask, just take your pointer down to the bottom. A bar should pop up and there's a chat function. Click on that and then click on, there's going to be a drop down that shows up of who you would like to send a message to or a chat. You click on that, you pick RESDC, which is me, and I will get the question and ask it to Matthew, even though we only have a few minutes. But if anybody just wanted to throw that out one more time, if folks did have a pressing question. And the second question I have is, can you expand a bit more on programs available for elderly with mental illness?
Certainly. So definitely one of the biggest challenges that we've identified, especially during the pandemic, is isolation and loneliness. Obviously, one of our big concerns, even more so during the pandemic, folks having to be, we've been sheltering at home for how many, days that, we've been on lockdown in certain parts of the year and so forth, and the fear of some that are not able to get out in the community. I've spoken to older adults who still continue to have that concern. But again, the ways to engage is probably the best recommendation. Yes, there are many mental health resources in our county that people can simply call our behavioral health department and the website that I alluded to earlier to get more mental health specific programs. But the one I certainly loved, I always appreciate sharing, is our Ways to Engage flyer. And the Ways to Engage, again, if I don't mind sharing again here, if I can reference it, and we get to the Covet specific, this is what we did, because we recognize that mental health and isolation and loneliness were that concern. So folks, if they click on mental health, again, have that phone number, the access and crisis line, can also reach out to other great organizations that work in partnership with behavioral health. For example, NAMI San Diego, Mental Health America, or those who may be managing substance abuse can also reach out. And even on our website, we have a Livewell at Home with older adults and seniors. So when you click on that, it goes directly to our livewellsd.com. And it's really about engaging, whether it be physical fitness, mindfulness, staying connected. There are organizations like Project Care, the program that I just shared with you all that we offer. Other organizations in our county are actually doing the same thing, and we encourage that. They're actually seeking volunteer older adults to call other older adults to just check in and say, let's chat. Let's just, we understand that, these times are troubling, but connection, what better way to keep folks connected and supported by just those simple phone calls. So staying connected, are definitely these ways that we can help support those and our own mental health during this time.
Okay, we did get a couple of other questions.
Great.
The next question is, can we get a copy of this presentation?
Absolutely. As you all may be aware, this is, or may not, the county information and the presentation is public info. So I'm always happy to share this information. I can forward it along to Mark via PDF. The PowerPoint's kind of, it's a big file, so it may not be able to be sent via PowerPoint, but I can send the PDF version, absolutely.
And for everybody on the call that would like a copy of the presentation, all I'm going to need you to do is, once I receive it from Matthew, is request it via our email address, which is resdec@resdec.net. That's our email address. And send an email requesting the March 2nd PowerPoint presentation, and I'd be happy to email it to you. Once again, it's resdec, RESDC, @resdec.net. Okay. The last question I have is, I have a friend with medium income, not on Medi-Cal. How can she get help in-home services? Where would she apply?
So that is in-home supportive services, again, is always, because it's the one that has the most stringent qualifications and requirement in order for someone to receive care. If she does not meet the income requirement for in-home supportive services, there may be some non-medical home care or private duty that I mentioned to that might fit her kind of budget or needs. So what we would always recommend is that whether she's comfortable with it or someone that can help her and support her on her behalf, just like any of us would. If we're choosing something, we want to make the best decision and best choice for our care. Or, if we're trying to, like, for example, like we buy a car, for example, we don't just buy the first car we buy. We recommend folks to learn about 3 home care organizations in their county, interview them all, determine if the budget, how they provide service meets the needs, and to choose the one that they feel ultimately most comfortable with to provide the care, because folks don't qualify for in-home. It's, well, what do I do now? So hopefully a home care agency might be a good option. I used to work in home care for a long time, for almost 10 years prior to coming to Aging Independent Services. And I know firsthand that some of the challenges of even quite possibly choosing a private caregiver. Don't get me wrong, yes, there are many good private caregivers in our county, but you always want to make that good choice of if you don't qualify for in-home support, to choose a home care agency that is that has coverage, that's able to, as a reputable service, that you won't get scammed if it's a private person that you're not comfortable with ultimately. So choosing home care is just as important as finding the right fit, and ultimately if someone doesn't qualify for IHSS, because yes, IHSS has those specific requirements to be Medi-Cal or eligible or currently on Medi-Cal.
Thank you very much, Matthew. Well, that was our last question. Once again, Matthew, thank you so much on behalf of the RESDC and all of our members for a great presentation today. And I want to thank everybody that's on the call for, you all did a great job with the muting and the turning the video off. We really appreciate your support in that. It was a great presentation. Once again, give us a couple days. This presentation will be posted on our RESDC YouTube page, which can be found at www.resdec.net. Want to thank everybody again for attending, and we will see you all next month, right, on April 6th, with more information to follow. Thank you so much. Oh, and Matthew, before I go, I just want to say I was receiving some very kind comments about the presentation as you were presenting and as people were exiting. So once again, thanks from everybody. Take care, everyone, and have a great day.
Bye-bye, everybody. Thank you.